gardening, very active man. He has multiple problems. Multiple problems is blood pressure, sugar, some lung disease. He also has a disease called myasthenia gravis. It is a disease of the muscle weakness. Amitabh Bachchan also had it some 20 years back, where all the muscles get damaged and very difficult, they can't even breathe. But with medication, it is under control. He is able to carry out his normal life. But these people cannot undergo anesthesia. If you give anesthesia, they will not recover from the anesthesia. So that disease also is got. He has got some kidney problem, he has got some mild stroke before, and he has got cardiac problems. So with all these problems on medical medicine, with the current technology, he is doing a normal life. But one day he comes with severe pain in the tummy, pain abdomen. And then he goes to a local doctor, they do an ultrasound and find that the artery, the abdominal aorta is huge, like a balloon, bulged out. The problem with this aneurysm is, when the aorta is bulged out, it is because of the weakness of the wall. If it ruptures, a small leak or a crack, the entire blood volume in the body will leak into the tummy and they will die instantaneously. It is one of the most catastrophic medical emergencies. But normally this aneurysm, it doesn't happen overnight. It is a slowly increasing bulging. So it should be able to be caught very early. And when it is bulging, say from 2 centimeters becomes 3 centimeters, 4 centimeters, we should be able to catch it. But many of the times, underdiagnosed or very late diagnosed, because people don't think of such a disease and doctors also will miss it. In a routine evaluation, it's very difficult to feel it in the hand, and unless someone does an ultrasound, you will miss it. In Western countries, ultrasound evaluation is compulsory after 60 years, one ultrasound. Every 5 years, they do an ultrasound. Here, it is not compulsory, so people miss it. Despite having so many medical issues, going to the doctor, he never had any complaint here, and no one also did that one. So in our country, no one is focusing on this disease because most of the doctors would not have heard of it. Those who are dealing with this disease will see it very common, but the general doctors might not be aware. A simple ultrasound scan of the abdomen will show that bulge. So this is what, you see that this we are doing an angiogram. Normally ultrasound will show the bulge. The main artery, this is the main artery which gives two kidney arteries, and if you see here a big bulge, huge one. The size was 100 millimeters. Normally we say if it is more than 50 millimeters, the chance of rupture is 10%. If the size becomes 70 millimeters, the chance of rupture is 20%. That means 1 in 5 will rupture and die instantaneously. 100 is extremely rare. Extremely. Most of these old big aneurysms, they are diagnosed during autopsy for some other disease, or they would have ruptured and autopsy will tell they were ruptured. But this was a huge aneurysm in the tummy, all blood. So this is because the wall of the artery is very weak. Some little bit weakening. One rupture here, the entire blood in the body will leak there and they will die soon. So the plan is we have to remove it. How do we do it? So what is it? This is abnormal bulging. Where commonly it happens here, it can also happen in the main aorta. So this is it. So this one, why it happens? Usually people with high blood pressure, especially smokers, that wall becomes weak and it can happen. And so what do we do with it? There are only, previously 25 years back, 20 years back, the only treatment was surgery. That is a very complex surgery. You go there, stop the aorta above, put some clamp, and then complex surgery, and the recovery from surgery is very difficult. Many of them used to die. The surgery is a very complex surgery. And of course, this type of bulge surgeons cannot touch because it's so huge. Then came something called stent grafting. What is done is, you don't touch the aneurysm. Inside you put a new artificial tube by angioplasty method. Just go from the groin, just put this tube and release it. So it just opens up. It is a closed mesh covered tube. So it constructs the normal aorta, and whatever bulge is there, no more blood will leak into that, and slowly it will get clotted out. It's a very simple technique. This has been there for almost 15 years. We have been doing a lot of this in a normal people. But this man unfortunately had a system where that mesh also cannot be put. Because to put that mesh, you have to put a trouser-like one into the right leg, one into the left leg. To put the trouser-like trap, you need certain size of the aorta below. Here there was a big bulge, below it was very narrow. So he has gone to several teams and all of them said, we cannot do anything. It's a no option. No option means we cannot do anything. It's the end of technology. But when he came over here, we said we can try a rare procedure. We have done it in different situations, but with this magnitude, it has never been done by us also. So we said we'll try this complex. We call it hybrid UR. Hybrid means most of the procedure is done by angioplasty route. We call it stent grafting. And one small part in the last a surgeon will do a local surgery in the leg itself. So we are not touching, opening the abdomen and putting him at risk. This patient cannot be given anesthesia also because so many medical problems, myasthenia gravis, and then he will not come out of anesthesia. So these are multiple high risks. So this is what we did. First we put a mesh tube there in the main aorta. So this is a fabric covered tube. So whatever bulge is there, blood will not leak anymore. It comes into this tube. And then put one more tube, second one into the left leg. Third side, now the right side is there. Now we can't put it in the right side. So what we do, we go to the right side and block the right leg artery with a plug. So 3 steps were done. And finally, we do the ballooning, and at the end of the procedure, the surgeon will connect right and left blood supply with a small bypass, which is a very small local anesthesia procedure. So with only that small little bit of surgical procedure in the last part, 3 major procedures, so we have completed the entire thing. So this procedure we have done under spinal anesthesia. The patient is talking and chatting with us, conscious patient. A situation where nothing can be done, now we have done while talking. He was extremely happy. 2 hours, procedure is over, and he remains stable, and of course, as usual, this type of patients, once you do a good procedure, you can see that there is no more leakage. That's it. Aneurysm is seen. He has done very well, discharged, and this type of very complex case, huge aneurysm, with so many problems where no hope situation also, we can, with this type of complex procedure, we can manage it very well. The procedure is very complex, but we have been doing this in a way which is imposing very, very minor risk to the patient. In fact, when we quote the risk also, this type of procedure, we told him we were sure 99.9 success, risk is only 1%. And we came out very well. So this is the main, this case highlights, even where no hope exists, we can create hope. Because technology is there, we have to use some innovative methods and then do that. And for every problem, right now I think we can give a solution, we have to plan it and then do it. So this is a very complexity and importance is such a 100 mm aneurysm. In fact, when he had approached some doctors and they said, there is no other way we can have to leave it. The question he was asking was only one thing. If it ruptures, what will happen? So actually the doctors will tell him, if it ruptures, you will die immediately. So at that point, his son was not willing to take. He said, whatever it takes, we'll do it. We'll go by it. So the procedure is a bit expensive because there are 3 steps where we use certain materials, and he could afford that 8.5 lakhs. It's done extremely well. The son was the most happiest. The patient was happy. The family, the grandchildren, everybody is happy. Every life saved and even a normal life is back to his routine. So my surgeon who helped in the last bypass is Dr. Balaji. He's the surgeon who helped in the femoral bypass. So the leg-to-leg bypass is the last part, which is very simple. In a talking patient, they cannot do the surgery. So I think you can ask.